It is an issue you do not hear about often, but Connecticut is experiencing a crisis in children's mental health. Today, the Connecticut Health Foundation shines a spotlight on the Keep the Promise Coalition. It is a grassroots effort to increase awareness and educate us all about this issue. Here to tell us more about it is Dr. Eric Arzubi with the Yale University School of Medicine. Dr. Arzubi is also the chairman of the Keep the Promise Coalition. Also joining us, Ann Nelson with the National Alliance on Mental Illness of Connecticut. Welcome to the both of you.
Hi, thanks for having us.
Thank you. Children's mental health. Let's set the stage for everybody. We're calling it a crisis.
It's indeed a crisis. What's happening is the following. About 20% of all kids struggle with some type of mental illness, whether we think of things that are very, very extreme or things that are actually quite common. And that adds up to about 150,000 kids in the state of Connecticut that are struggling with this. And only 25% of those kids actually get the services they need. So it's a real crisis.
Why aren't these kids getting the services that they need, Ann?
I think there's many reasons, but the ones that, as a family member, I have a daughter who has some mental health issues. I think stigma is a large one. I think how we look at mental illness in our society is one of failure, one of bad parenting, one of dangerous children, and I think there's a real hesitancy to seek treatment or admit as a family or as a child or an adult, much less, that you have a mental illness. There's a real foreboding feeling about that word.
Well, what treatments are there available?
Well, you know, actually, Justin, before I answer that question, one of the things, as you said, it's something we don't necessarily hear a lot about. And
it's true.
I think I might challenge that notion because it's something we hear about every day. If you think about it, you know, cyberbullying, bullying, academic problems, divorce, family struggle, financial hardship, drugs and alcohol problems. These are things that affect child mental health every single day.
That all goes to child mental health?
It all affects child mental health, all of it. And so one of the things I think is important to underscore here is that there's this notion that child mental health affects, you know, a tiny proportion of people with sort of extreme mental illness, and you know, and it's a terrible thing for those few that struggle with severe mental illness. But again, it's much broader than that. And I think that's what's important to underscore here.
All right, let's talk about what is available for parents and their families as well. What is there?
Well, there are some incredible treatments that have been validated by research, meaning they work. I think it's really important to know that treatment does work, because many times we assume that these folks, children, whatever, will automatically end up in the juvenile justice system or unemployed. But the reality is that our treatments work. We just don't have access to them. And access means funding. It means in our community. It means that these services are strength-based and family-involved. And one of the reasons that we don't receive them, I think it comes down to the bottom line of money. We end up investing in our state as well as in our nation into more of the crisis-oriented institutionalized care, which is enormously expensive, which hasn't been validated to be effective.
No, you bring up a great point. Unfortunately, what happens because there's such little access to good mental health treatment early in the problem, really preventative care. So what happens is there's kind of this wait to fail model where people end up in the emergency rooms treating sort of major crises rather than handling it beforehand. So that really compounds the problem and increases costs above and beyond what it should be.
So where is the Keep the Promise Coalition? Where does that come in?
So the Keep the Promise Coalition is actually, it's over 10 years old actually. It's this wonderful coalition of many organizations around the state that are dedicated to improving mental health services around the state. Most recently, we've actually been able to energize the children's focused part of the Keep the Promise Coalition, and to that point have recruited, for example, the American Academy of Pediatrics, the Connecticut chapter, also the Academy of Child and Adolescent Psychiatry, along with a whole bunch of community-based family organizations to join this effort to really energize the movement to improve child mental health.
Is the key here the school system as well?
That's a great question. It turns out the school system is actually the biggest provider of mental health services in the country, and it's something that's really not talked about much. And the problem is the school system has to not only deal with these issues, behavioral issues, but guess what? They're focused on school outcomes, better grades, child performance in school. So one of the things that I think is it could be an exciting issue for politicians to tackle, because by tackling child mental health, you can improve school outcomes, you can improve behavioral health in general, you can reduce healthcare costs, you can reduce the burden on the juvenile justice system, which is really stretched by this problem. It turns out up to 25% of all kids in the juvenile justice system actually struggle with mental illness. So it's become kind of this, it's as the mental health problem becomes more of a problem, the juvenile justice system is becoming more burdened as well.
Where can parents get the information that they need?
NAMI, Connecticut. NAMI is a grassroots organization that has a Connecticut system. We have community affiliates and support groups. NAMI has a threefold mission of support, which is in the form of support groups. There are support groups in towns. If you go to our website, how about if I do a pitch for that?
Sure, go
Just
ahead.
because that would be the best way. www.namict.org, and there's a list of support groups. They have arms and tentacles out to many communities. We also, our second pillar of our mission is education. There are educational programs where families can come alongside each other, because the biggest thing as a family member is you feel like you're the worst parent, you're alone, and that somehow you failed. So
Well, the process is very frustrating for parents and their families.
I'm a nurse. My husband, my ex-husband, is a physician, and I am so blessed. I mean, we do well economically, but I couldn't get services for my daughter. And if someone who has access to private insurance can't get services, I can only imagine what it's like for folks who don't have private insurance. So the greatest difficulty is really trying to find people who will legitimize it and finding access to funding for it.
It turns out it's actually what Ann was referring to. It's really a tale of two systems. You know, interestingly, the Connecticut Health Foundation has actually invested millions and millions of dollars on improving access to mental health care for kids aged 6 to 14, because what's happening is the following: kids who are black and Hispanic are more likely, when identified to have emotional behavior problems, are more likely to go into the juvenile justice system than their white counterparts who will be referred to treatment. But guess what? Even if those kids are referred to treatment, they don't have access to them. So it's a real lose-lose situation right now.
So what we want to do is try to help resolve that, and you're doing it by promoting this gubernatorial forum. Let's talk about it. It's on Friday, October 22nd, 6:30 p.m. at Woodrow Wilson Middle School in Middletown, Connecticut. And what's going to be happening there?
So this is very exciting. This is the first time in the state of Connecticut that we've had a forum for gubernatorial candidates focusing only on mental health issues. Even more exciting for me, because I'm going into child psychiatry, is that we're focusing this on child mental health issues. So I think we've been able to convince the future leader of our state, which is one of the three candidates, that this issue is important enough to warrant their attention. We've also recruited a lot of new groups into the Keep the Promise Coalition to really help push this effort forward. So we feel it's very exciting. It's a unique, really one-of-a-kind forum that we haven't had before.
It is. And just really quickly, how do you RSVP to this?
RSVP to Connecticut.
Actually, yeah, sure. I'll give the email address. So it's very important that people RSVP so we know how many people will be showing up, but we want everyone to come out because we need to show them how important this is. So it's ktpchildrensforum@gmail.com. So it's ktpchildrensforum@gmail.com.
Very good. Thank you so much for joining us. We appreciate it. And the information is so important for families out there. Coming up next, we're in the kitchen with